Good morning, everyone, and thank you so much for being here this morning and for tuning in as well. I want to first begin, as always, by thanking our Chief Health Officer, Dr. Carter, for being here this morning, and others. We have others who are here from the Health Department this morning, and I want to thank all of them. Thank our Deputy Chief Administrative Officer, Dr. Askew. Our entire Health Department team is just phenomenal. Likewise, would like to, as always, extend my gratitude to all of the doctors, nurses, all of our frontline workers, essential workers who have really continued to work throughout this pandemic to ensure that our families have been safe. They've done so day in and day out without ceasing, and I do want to thank them so much for their sacrifices. Today, I want to provide important updates on COVID-19, including new guidelines that we are putting in place to reduce the spread of this illness, as well as updates to programs that we're making in order to help our county businesses and to help our residents. As you know, COVID-19 continues to affect Prince Georgians. We currently stand at 35,434 confirmed cases of COVID-19 since March. We've also had 4,174 hospitalizations. I know you're going to hear from Dr. Carter this morning, who will tell you that part of what is alarming us is I'm hearing that those hospitalizations are increasing very rapidly. We've also, unfortunately, had 865 Prince Georgians who have lost their lives during this pandemic, and we continue to pray for them, to think about them, to do everything we can to try to support them and their families. And I urge all Prince Georgians to do likewise, to remember that people are still suffering, and to especially remember during the holiday season that can be very lonely for many, to remember all of those who are suffering and who have lost loved ones. Unfortunately, like the rest of our state and across this nation, our infection rate is trending in the wrong direction. During the first week of November, we saw 1,309 total cases of COVID-19. This is up from a recent low of 649 cases the last full week of September. In addition, our infection rate has increased to 1.15, which places us now in high risk with steadily increasing COVID-19 cases. We've also seen an increase in the overall number of cases. As of November 7th, the average daily case rate has increased to 20.6 cases per day per 100,000 residents. And you will remember, for those who have been tuning in, that Dr. Carter has long told us that the place we wanted to be was below 10 cases per 100,000 residents, and so we are now double that and rising. Prince Georgians have worked so hard to limit the spread of COVID-19, but we have told you, and it is still the case, that we're not finished yet with this particular fight, and so we really have to hunker down. That is the message of today. I'm going to give you much more information, but if you don't hear anything else I say, it is time to hunker down. We are there in the midst of another surge, and based on the data that our public health officials have gathered through a variety of sources, including contact tracing, we have found that gatherings indoors are very dangerous. Our work lines up with national findings. We've been making sure that we check data here and across the country, but Northwestern University shows us that indoor venues present a special risk of COVID-19 spread. And so gathering inside places like gyms and coffee shops, restaurants, hotels, bowling alleys does present a special risk of spreading COVID-19, while some indoor gatherings present a slightly less, it's a lower risk associated with some of our indoor activities. And so overall, we know that limiting the capacity of indoor establishments is an excellent strategy for limiting the spread. And one of the other things I want to say to you, and it was very important to say that we have looked at our data. So all of the decisions that we're making going forward are data-driven decisions. In other words, we're following the contact tracing to tell us which particular activities are the ones that are most dangerous. We are not using a broad brush in terms of giving guidance and making adjustments. We're going directly to the areas where we see the infection rates are increasing. And so with this in mind, we're announcing new guidelines to reduce the spread of COVID. And I want to be clear again, these are the guidelines that must be implemented, and they have not been selected arbitrarily. We have spent a great amount of time deciding which ways we could most reduce the spread. And so these new guidelines will take effect on Sunday at 5 p.m., and I will go over them now, but please note that a full list contained within a health order that Dr. Carter has issued will be available online very soon. The first area that we're going to discuss is large gatherings of people. You've heard us say it over and over again. This is the place where our data has been very consistent. We know that these gatherings, the social, community, spiritual, religious, recreational, leisure, and sporting gatherings are where we are very concerned. And so we're limiting to one person or family per 200 square feet. A maximum of 25 persons may gather at outdoor locations, and only 10 people may gather indoors. And we're urging that that does include private residences, private facilities, and public facilities, unless otherwise specified by Dr. Carter. This is the best guidance that we have. And you've heard it over and over again, that all of our contact tracing data tells us that the family gatherings, the parties, the social gatherings, the football parties, all of those are areas that we are seeing really contribute to the spread and our super spreader events. Our gyms do remain open with strict requirements that no more than one patron per 200 square feet and no more than 25% capacity overall. Bowling alleys, another area where we have worked along with our compliance officers very diligently. We've sent out folks. Our ambassadors have been out to the bowling alleys, but these are areas that are risky and are of concern to us, and so they may remain open, but at a maximum of 25% capacity and no more than 50 people, whichever is lower. Restaurants may continue to operate, but capacity is limited to 25% maximum indoors and 50% outdoors. And I want to also reiterate that we do encourage you to wear the mask even when you're inside those indoor dining establishments, except when you're eating, to help us really limit the spread inside those establishments. Our essential businesses, including grocery stores, specialty food stores, pharmacies, and large chain retail, must operate within certain guidelines. And this is an area that I have to tell you we're very concerned about, especially as the holidays approach. And so we have a maximum capacity there of 50%, and we are encouraging people to follow the guidelines. Most of our guidance of capacity limits in retail, big box stores and restaurants remain the same, but what we have noticed, and I'm sure that the community has noticed this as well, is the issue for us is enforcement. We understand that people must go to these large retail establishments. We understand that they are essential, many of them to grocery stores, going into the larger box stores, but we have to be really vigilant to make sure that we are adhering to all of the guidelines that have been put in place, including the social distancing. We want to make sure that as you go into the grocery store, make sure you're wiping down your cart, make sure that you are really adhering to all of those guidelines, and we are placing the onus on the owners of these establishments, because if you are like me, we've noticed that the stores are full of people. And I'd go into those stores, and in some instances, I'm concerned. They are full of people, and this is, we want people there shopping, but we have to make sure that all of those establishments are not only safe for the people who are shopping, but you might recall that we are very concerned about our essential workers who have to go into those stores to earn a living. We want to make sure that those establishments are safe for all of them. So we are really going to be working hard with our compliance team to make sure that we're going out, even in the large box stores, to make sure that they are complying with all of the guidelines that have been set forth. This means at 50% maximum capacity that in some cases you are going to have to plan when to shop, because that means that we don't want the stores full at certain hours. So please do plan accordingly so that you can get in and out of that store and use the hours where it is most convenient for you to do that. But we're going to be working with the stores to make sure that that happens, and that grocery stores also are enforcing the facial coverings. Please, ma'am, please, sir, let's please continue to be very respectful of each other where the facial coverings are concerned. And you've heard me say it before, the facial covering does us no good if it is beneath your nose. So the Dr. Carter, I'm sure, will tell you this, that even in those stores, please make sure that the facial covering is covering your entire area. The virus lives in the nose. And so not covering your nose is the most dangerous thing that you can do. It does not help us if your nose is exposed in any way, and I'm sure that Dr. Carter will reinforce that. And we also are concerned about hotels. Got to be honest with you that hotels that allow rooms, they've allowed these parties to take place, rent rooms. We've had parents who have been renting rooms for minors. And you've heard me say it before, but we have to really double down on this right now. We will be imposing fines, and when necessary, we'll be closing down establishments that have allowed the parties to persist. This is not the time or the place to rent out rooms for minors in large numbers and have those children and their families become sick. So we will continue to seek out promoters of parties for fines and other penalties, as well as property owners who allow these gatherings to occur. And unlike other jurisdictions, Prince George's does have the benefit of that compliance team. I want to thank them. They have done an amazing job. They are out all week long to really isolate the establishments and individuals who are in violation so that we can address those issues, because again, we do not want to paint with a broad brush, because we understand that there are some of our businesses, I dare say most of our businesses have gone really above and beyond to make sure that they are complying with all of the guidelines and making sure that they are adhering to all of these policies. And so the compliance team will be out and about to make sure that we're able to isolate those individuals who are not complying, so that we don't have to close everything once again. We want to make sure that we're only going where needed, and we need the community's help. So that means that if you see a violation or an unsafe situation in an establishment with safety protocols are not being adhered to, we ask that you would please call 311 and report it. 311 is open Monday through Friday from 7 a.m. until 2 a.m. And on Saturday and Sunday, it's open from 7 p.m. to 2 a.m. So please call us so that we can send our compliance team out to investigate and address violations. We are also announcing another important executive order regarding face coverings. Now, in addition to wearing face coverings indoors, to indoor locations where members of the public are generally permitted, including retail, restaurant, business establishments, and county buildings, face coverings are now required outdoors as well, unless you are engaged in rigorous exercise. And so we want that facial covering to be on at all times, unless you are engaged in a rigorous exercise, because we don't want people to be unhealthy and to become sick in that way. But we are asking that if you leave your home, please cover your face. All persons over the age of 5 should wear a mask. Adults accompanying children aged 2 to 4 should make reasonable efforts to have those children wear face coverings as well. And I want to take a moment. Unfortunately, I have to go back and talk about National Harbor. We have stepped up enforcement in that area since the summer, but we are really going to need our families to step up and work with us with respect to our children. I have to just make myself crystal clear when I say it is absolutely unacceptable to drop off unaccompanied minors to hang out at the National Harbor, who are not there to shop, who are not there to dine, and who are not there with a responsible adult. The National Harbor is a place of business. It's a place where people go to conduct business, to shop. It is a place where people live. We have a good number of residents who live at National Harbor. I've been hearing from them. I've been hearing from the businesses. They do not want unaccompanied children hanging out at the National Harbor. It is causing a very unsafe situation, not only for those children, but it is disruptive. So please, ma'am, please, sir, do not drop off your kids to socialize at the National Harbor. And I get it. My 15-year-old daughter came to me earlier this week and said, you know, I hear that it's turned up at the National Harbor. I'd like you to drive me down there this Saturday because I don't want to miss out. I want to see what's going on down at the National Harbor. I told her, absolutely not. We shop or dine at the National Harbor, but I understand the temptation. And some of the kids are saying to the parents, it's okay. You can just drop me off down there and come back at hours later and pick me up. And I want you to know that if your kids are asking you to do that, that this is not acceptable. We do not want it to happen, and we are going to be working with the National Harbor. In fact, we are going to be engaged in a call tonight because, again, I'm hearing from those. Remember, people live also at the National Harbor. They are very concerned about their quality of life, and so we'll be working to take action there to make sure that we keep that particular venue safe for everyone. and to put new restrictions in that will make it difficult to continue to drop off kids down there. Now, I also want to talk about the fact that, you know, again, we can't do this work alone. And so I want to thank everyone, including all of our residents and business and community members who have worked with us to help us stop the spread of this virus. We can do this. We can do this, but it just means that we're going to have to work together and to do all the things we've already heard about: wearing the facial mask, washing your hands, social distancing, and doing all of the things that we've been instructed to do. Now, while we're stepping up our enforcement efforts around COVID-19 orders, I am also excited to announce that we are providing new resources to help restaurant owners this winter through our Restaurant Resiliency Fund. Let me just say that our restaurants have just been so resilient and so wonderful, but they have really, really suffered. And so during this time, we will be providing grants of up to $25,000 to Prince George's County-based restaurants and food establishments. Businesses may use the grant for COVID-related costs, including PPE, winterization for outdoor seating, interior improvements to support social distancing, and others. We're going to do everything we can to continue to support our businesses. I urge you also to please continue to support our restaurants and our businesses during this very difficult time as we all make it through this together. Applications will be reviewed on a first-come, first-served basis. Grants will be awarded on a rolling basis, and the applications will be accepted between November 13th, 2020 and December 18th, 2020. And to apply, you can visit www.pgcedc.com/restaurant fund. Again, www.pgcedc.com/restaurant fund. And again, please support our businesses. I don't know how many of you saw the Washington Post yesterday. Y'all know I don't, you know, I'm not afraid to brag on Prince Georgians, and we have the #1 barbecue establishment right here in Prince George's County. So I encourage all of you all to visit those businesses and to patronize. We have some really wonderful ones right here at home. In addition to the help that we're giving to our county's restaurants, we are also making changes to the COVID-19 Hourly Employee Relief Fund because we realize that many of our workers have been impacted. And so we've launched a grant program called the COVID-19 Rapid Reemployment Grant. And we're expanding also our successful COVID-19 Hourly Employee Relief Fund to help more Prince Georgians. Since July, Employ Prince George's has raised over $700,000 and distributed over $380,000 in the form of $200 Visa gift cards to residents who have lost their jobs. And so beginning November 11th, Employ Prince George's is now allowing previous applicants to reapply if they remain unemployed, and we're increasing the Visa gift card amount from $200 to $300, and this is again for our residents who have lost income due to COVID. Employ Prince George's goal is to distribute the remainder of the funds by December 14th, and residents can apply at www.employpgedge.com. In addition, we are launching the COVID-19 Rapid Reemployment Grant Program to help businesses and to encourage them to hire Prince George's County residents. Employ Prince George's will distribute $500,000 in grants to businesses who hire Prince George's County residents prior to December 15th. Businesses that hire Prince George's residents before December 15th will qualify for up to $15,000 per new employee hired. We want to keep our folks employed, and so we urge our businesses to please engage. Businesses who hire unemployed Prince George's residents will be eligible for grants that supplement 50 to 90% of the employee's salary during the agreed upon period, and grants will be provided to businesses on the employee's first day of the job. In total, businesses are eligible for up to $50,000 in grants through this new program, and businesses interested in this grant program may apply on the Employ Prince George's website, employpg.org. In addition to these programs for our employees and employers, last week we also announced Saturday service for the bus in Prince George's County. This is yet another way we want to be able to support all of our essential workers who are trying to find ways to get back and forth to work. Saturday service is now available on 13 of our bus routes, and these lines help connect residents in Langley Park, West Hyattsville, New Carrollton, Largo, Forestville, Camp Springs, Upper Marlboro, and Brandywine. And this represents for us a critical step forward in our transportation system, one that many of our residents have expressed interest in using. And it's also critical, again, for our essential workers who are relying on transportation. We'll continue to grow our public transportation services to match demand across our growing county, and we want Prince George's to be accessible for all of our residents. So if you plan to use the bus, please remember to observe COVID-19 guidelines. Please wear your face coverings. Remember that they are required not only to keep our passengers safe, but we also are working to keep our drivers, transit drivers, and employees safe. So please do, again, remember to wear that mask and wear it properly. And we encourage our passengers, please, also to wash and sanitize your hands. The 2020 election, I want to just briefly provide an update on the 2020 election. We have preliminary numbers of ballots cast in the race. And before I go on, I want to tell you, I'm going to give you some of the numbers, let you know that they are subject to change. But Prince George's County had 128,831 residents vote early between October 26th and November 2nd. Additionally, 231,878 mail-in ballots have been returned, and 36,631 Prince Georgians voted in person on Election Day. It's absolutely amazing. We had this election cycle 604,369 registered voters, and I want you to know that close to 400,000 of you, we've counted close to 400,000 ballots, 397,000 of you voted. That was the highest number of people who have ever voted in Prince George's County. So we thank you all. You did it in the middle of a pandemic, and I just wanted to come back because I know we talk much about it, to not only thank our residents and others who were so determined to vote, but the Board of Election led by Alicia Alexander, Deneen Banks, and all of the Board of Election staff, our volunteers who orchestrated the process, and everyone who came out to participate did a phenomenal job. And we just want to thank you all so very, very much, everyone who participated in our election. And finally, I want to just thank our residents again for taking all of these precautions. We know Prince Georgians have just done a beautiful job of listening to all of the guidance we have given you. We know that you are fatigued of COVID-19. I am fatigued of COVID-19. All of us are tired of COVID-19, but it is so imperative that we just stay the course. As I have mentioned, and I know Dr. Carter is prepared to come up and say now, we are far from done with this particular virus, unfortunately, and the measures that we take are designed not only to save and preserve your own life, but to preserve the lives of people we care about, our family members, our neighbors, our colleagues. And so this is what we are doing as one Prince George's to make sure that we get through this virus safely. And as I have promised you, COVID-19 will not have the final say. We absolutely will, but I ask you please to continue to hunker down, especially as we approach the holidays, and to continue to take care of each other. So thank you all so much for everything you've done. I also want to just thank the business community, who I know likewise has suffered greatly, and to say that we're all in this together and we'll continue to work together. Thank you so much. And now I'd like to bring up Dr. Carter.
Thank you, Madam County Exec. Thank you for your leadership. And thank you all for tuning in today. The data we're seeing are troubling. This needs to be a call to action for every resident in this county because another COVID wave has arrived. Making the safe and smart choices in our daily lives will slow it down. We can show this virus who's in charge here. We, the people, are in charge of our health and wellness, but we have to take charge. We will win this match, but how long it takes is up to us. We must fight through this COVID fatigue that we're all having. I'm having it too. We will win, though. We definitely will win. We will all have to recommit ourselves to making the necessary sacrifices now. The sooner we can, the quicker we'll get to normalcy. I am very concerned about the rapid increases we're seeing across the board in our numbers. Last week, we saw a 20% jump in our new cases to 1,309. In the last month, our cases have nearly doubled. And we've seen 4 consecutive weeks of new cases going up. Right now, on average, there are over 20 new COVID cases each day per 100,000 population in our county. That's the highest mark we've seen since May. The county is squarely in the high-risk category for COVID spread now, which means the community spread has accelerated and is at dangerous levels. We are rapidly approaching a daily case rate of 25, which would move us up into the critical category in terms of COVID transmission. Critical means jurisdictions have reached a tipping point of uncontrolled spread, and additional restrictions are needed. On top of that announcement today, I have to give you that warning. Again, we are not quite there yet, but it is something to really keep in mind that we're headed that way. So what we do matters. Our COVID test positivity rate is also on the rise. It is now at 6.4%. We've not been in that territory since early July. The infection rate, which measures how many other people somebody with COVID infects, is going up also. The county's infection rate is 1.15 and trending further into the high-risk category for community spread. In other words, more than one person on average is infected by someone else who has the virus. The goal is to have an infection rate stay below 0.9 or less. So we've got to keep working. We've got to work on this. It's very important. The county has not been below 1 for a month now. It's been a few months since I've felt the need to discuss hospitalizations, but with new cases rapidly rising, the number of people in hospital beds in the county due to COVID has increased. Last week, the average number of hospitalizations due to COVID was 69. That's the highest average number we've seen since June, and a 58% increase from where we were over a month ago. Our increase is escalating. So just in the last 2 days, we've seen a 27-bed increase in hospitalization. And looking back over the past 2 weeks, the number of inpatients with COVID has nearly doubled in our county hospitals. Thankfully, our hospital capacity remains very strong. Bed availability in intensive care units are at 62%. However, we have to get a rapid, we absolutely have to get it under control, because if we don't, there'll be a rapid rise in our intensive care units, and we'll have to do further things to make sure we have that capacity. The county is monitoring these numbers and working with our hospital systems as they prepare for higher demand. Substantial and sustained reductions in the numbers will take all of us working together. Earlier, I had mentioned making smart choices. Here they are. Wear a face mask in public, period. If you leave your house, then you're in public. Then you have to have a mask on. Stay at least 6 feet away from people who do not live with you. Even if you are 6 feet or more away from another person, you must have your mask on. Even if you're with a household member and you're outside of your house, you have to wear a mask. Wash your hands and disinfect surfaces as often as you can. These are important. I know I've repeated them a lot, but these are the things that will help you. These were the things that will curb it. These were the things that will make the virus not spread as much. And one of the smartest choices we can make is not hosting or attending gatherings with families and friends, even for Thanksgiving, because the virus is spreading rapidly. This is not the time. We keep seeing the same data from our contact tracing interviews. Attending family gatherings and house parties are the leading high-risk activities reported by those who have virus. This is why the county executive's new gathering restrictions are so important to do right now. To repeat, these new gathering restrictions are in the outdoors, it's a maximum of 25 people. For indoors, the maximum number is 10, provided everybody wears a mask and stays 6 feet from each other the whole time. Now, the 10-person maximum rule indoors means that there can only be one person per 200 square feet in a space in order for people to safely social distance. It does not mean you can cram 10 people in your apartment thinking you're following the rules. Let's do a little math to hammer that home. Let's say your apartment's 600 square feet. In order for everybody to stay 6 feet apart from each other, there can only be 3 people in the apartment at the same time. Okay, you understand that? Say you're a church and you're going to have a gathering in your church basement, and your church basement is 800 square feet. You cannot have an event there with more than 4 people. That's 4 people. It's 1 person for every 200 square feet. If the basement is 1,000 square feet, you can only have 1 extra person there to a maximum of 5 people. If you have an indoor space that is 2,000 square feet, you've reached the maximum of 10 people already. After that, that's it. Any space that is larger than that is limited to a maximum of 10 people, no matter how big it is. Now, tightening indoor capacity for certain businesses is a step we need to take right now as well. For instance, given the state of our COVID spread right now, a restaurant that is half full inside presents too much opportunity for people to let their guard down. Lowering your mask at the table for too long or doing it to eat or drink can be risky, especially if the business is at a certain capacity. Bringing down indoor business capacity to 25% can reduce the chance customers and employees get infected. And the reason for that is that the virus is much more stable now than it was. So now the virus spreads faster and easier. So that's why we have to lower it. It's very important for you to understand that. Based on our contact tracing interviews with those who've had tested positive, going into work is often reported as one of the leading causes of getting COVID virus. So we know transmission is happening at the businesses. So when people go to work, you have to also be very vigilant about wearing a mask, staying 6 feet apart, because a lot of the numbers we get back come from people who go to work. We got to keep them safe, as the county executive said. This highlights how contact tracing is helping us find the virus so we can fight the virus by taking the appropriate action. These new restrictions come as colder weather arrives and people will be drawn inside to celebrate November and December holidays. Now, as tough as that is, and I know it's tough, and I know it's tough for you all to hear this, but the health department strongly recommends not attending or hosting holiday gatherings with people who are not in your immediate household, especially indoor gatherings. We recommend small gatherings with only your household members. Schedule an online session or put your cell phone on speaker. You can still catch up. Your loved ones will still love you. I know mine do. So that's important. We also recommend not traveling for Thanksgiving. The virus is spreading like it's spreading. Traveling is not recommended. If you must travel, drive your own vehicle, and driving your own vehicle will reduce your exposure. Please do not travel if you are sick, if you have recently tested positive for COVID-19, if you're waiting for results for a COVID-19 test, and do not travel if you've had close contact in the past 14 days with a person who has tested positive or who has symptoms of COVID-19. If so, please get tested. I encourage everybody to stay informed and engaged in this long battle. Tell your family and friends and co-workers to visit our website and follow us and the county executive on social media to get important updates about COVID testing, safety guidance, and the latest data and other services. Take care of yourself. Take care of everybody else. And don't forget to call your parents and grandparents or anyone you'll miss at the table this year. They may need the additional comfort. I know they will. So thank you very much.
So I just want to also let you all know the Dr. Carter's health order, as well as our additional guidance, will be available on our county website, mypgc.us, later this afternoon. So probably by close of business, as well as if you follow the county executive on social media or the health department, you'll see a number of new infographics that will explain what some of the guidance is now. We'll take questions. Tracy.
Okay, so the number of 10 people, the 10-person gathering is for those family gatherings and other social gatherings. For retail, we have now capped retail at 50%, and that still is the 1 per 200 square foot, and that's the social distancing portion of it. So we want the stores to know that they have to now continue those markings to make sure that people are socially distanced. But the 10-person cap is for those other social and family gatherings. That's what we're talking about there.
So Dr. Carter just mentioned, so for instance, if you're in a church with a small basement, then we didn't want more than 10 there. So it's going to be clear.
So the churches have a capacity of 25%, and outdoors is 125. I think we've cut that in half outside the amount. So I'm sorry if that was confusing. So for the churches, the guidance is 125 persons outside, and indoors a capacity of 25%. Still with the 1 per 200 square feet. Yes.
I can follow along with Tracy here as well. Got some big stores up the street. We have lines outside Costco, for instance, and lines outside Wegmans when they were monitoring the number of people going inside. Not that you want to get back to line, but you want to get back to where we were before, where all of the retail establishments were counting the people and controlling access.
Absolutely. That's what this is all about, is we want to make sure that our retail establishments have not become lax. I have noticed that in the grocer that I go to, they're no longer counting the people as they come in. They're no longer sanitizing the carts, making sure that people are distanced while they're in the store. And I think that, again, people just got a little comfortable, and we want to make sure that, again, this is in the interest of not only those who are shopping, but we have essential workers who are in these stores working, and we want to make sure that for their safety, that we're also adhering to all of those guidelines so that they can be safe as well. And this just means that people have to plan. I'm not excited about the notion of having people stand in lines outside stores, especially as the weather is getting colder. But we want people to be aware of this so that they can plan to go to the store at a time where maybe it's less crowded, that the store can also make, particular accommodations to make sure that they get people in and out. But this is just a warning, again, to all of the retailers, the big box retailers in particular, that we do want them to be vigilant and to be careful, because there is a great risk in mass gatherings. That's essentially what we are trying to prevent, is mass gatherings, large gatherings of people who are not socially distant.
Couple of quick things. I spent some time last night looking at all the models projecting out. It's not good. Looking at the peak late January. Is it your hope, is it your belief, that both of you, I suppose, that if we do all these things, if we wear our masks, if we follow these guidelines, if the stores get back to it, that we can cap our restrictions at about this and avoid, is that the carrot stick thing? If you do all this, we can avoid those?
That's exactly, the hope is that we can really cut off what we're seeing as escalating numbers, and we know this is possible. We were able to do it before. We know that when our residents and others really became diligent in terms of remembering to social distance, to wear their facial coverings, when the stores were compliant, we saw those numbers come down. And so we know that we can do this again. And we now know the formula for making sure that these numbers are declining, that the positivity rate goes down, that we get those hospitalizations down. We know how to do this because we did it before. But we know Dr. Carter is telling us that as the cool weather comes in, that apparently the virus travels more easily during cold weather, that the humidity and heat prevented the virus from entering the nose. But as the temperatures drop, the virus it's easier for it to travel, and it can more easily get into your nose. So yes, the point of the matter is this is not forever, God willing. But we want people right now to take the actions that are necessary so we can get this thing behind us. The faster people comply, let's please get this virus out of our community. And the way for us to do that is to make sure that we are comply. We want it gone, please. And the faster we all comply and we do it together, we can stop the spread of the virus and get some normalcy back. All of us are sick of COVID-19, to be honest with you, but the faster we comply, the better off we'll be.
And ultimately, again, the football team. What's the order going to be to them? They're not home this weekend. I believe they're home next weekend.
There's some specific guidance. Dr. Carter, can you talk about that?
Yeah, with the football team, we're in constant communication with the football team, and we evaluate how they're spaced whether we have fans in the stadium or not. And it's we basically daily look at the numbers. So we're actually going to be in conversation with them a little later, either today or tomorrow.
Well, they're not blanket covered by the new order on outside gatherings.
No, we don't specifically talk about the Washington team in our orders.
That actually falls under Dr. Carter's discretion. Will?
I want to make sure I heard what the Dr. mentioned about what you're seeing from the cases are being high at large gatherings. Just not here, people going to work too. I want to make sure if I heard that. If that's the case,
Yes.
is there a recommendation to have businesses have people told?
No, well, the recommendation is the people who go to work typically have to go to work for two reasons. One is essential, and the second is they need the money. So we're not stopping the businesses right now, but what we're saying is, and we're emphasizing it, the county exec does, I do, you're at work, wear the mask at all times. You're at work, stay 6 feet apart, all times. At work, clean your surfaces every hour. At the minimum, you should be cleaning your surfaces, cleaning your hands, and you have to stay away from people. What's happening at work, and because we've seen it, we've observed it, people break all of those rules. They've got to follow them. That's it.
Following and seeing what has been going on.
Mm-hmm.
Has there been a little bit of a problem with people not saying or telling the truth where they've been? Especially if you've seen gatherings going on, people in stores that are piling up.
I can't tell you from the contract tracing data whether or not people are telling the truth. I can't do that. Okay. Okay.
These guidelines are kind of similar to Montgomery counties that were just instituted. But one of the things they have is if you're going into a restaurant, whether you're eating indoors or outdoors, you're supposed to sign in voluntarily that you're there so that they can contact you after. Are you going to do anything like that? And if so, will it just be voluntary?
Well, we haven't instituted that. You want to say something about that?
I think the contact tracing is important to collect data for contact tracing. That's something we can talk to Dr. Carter about, whether or not we should add that to the guidance that we're giving to businesses. But contact tracing, we know, is very important to be able to contact individuals quickly and to prevent the spread. So will talk to Dr. Carter about that.
Follow up on that. Yesterday I was at a Silver Spring restaurant that was pretty much close to the 25% maximum capacity, but not a single person had actually signed in on that sheet. And so would you be considering somehow to make that mandatory in some way?
That's something we'd have to look at. It's not a part of our order at this moment, but that's something certainly that we can let the health department look at and give us guidance about whether or not that's what they recommend.
Any other questions? Thank you, everybody.
Thank you so much, everyone.